And the financial cost to our society is huge. But of course, the costs go way beyond that. They're a grandkid never being able to play a game with their grandparent. They're a spouse having to take care of their wife or husband when they don't even remember their name anymore. And these costs are going up because as our society ages, the average life expectancy goes up, more and more people are going to have this diagnosis. My name is Scott Selleck. I'm a professor of biochemistry and molecular biology at Penn State University. Alzheimer's is a progressive neurodegenerative disease. So it gets worse over time. It may start with subtle changes in memory that are, of course, often mistaken for, oh, this is just normal, I've forgotten where I put my keys. But as time goes on, it becomes pretty clear that these are not normal memory lapses. The outcome of that degenerative process is death. So it is not a trivial diagnosis. It matters how active you are. It matters whether or not you control your type 2 diabetes. It matters if you spend time engaging your friends and family. Do you have a social network that is valuable to you? Because there is very good evidence that those things, exercise, what is your diet? Do you have normal weight? Are you controlling your type 2 diabetes? There's evidence that all of those changes can slow or delay the onset of the disease. A lot of the attention in the past 30 years has been on features that occur fairly late in the disease. And it makes sense, of course, that if you're really going to stop the disorder and treat it effectively, you want to know the earliest possible derangements to intervene there. So our work is aimed at identifying what those early events are and then devising interventions that will prevent the progression of those problems, to reverse those cellular and molecular abnormalities that lead to decline, not simply make things better towards the end of the disease, but nip it in the bud. These fundamental changes in how cells work, these abnormalities occur early in multiple disorders. So we uncovered a pathway that regulates these cell repair processes, and they also regulate metabolism, especially the metabolism of lipids. And disruptions of lipid metabolism are a very important contributor to these neurodegenerative disorders. So we made some observations that were surprising to us, but suggested we might have an avenue in finding a way to increase the ability of cells to repair and to prevent the continued damage and accumulating damage that occurs in the course of the disease. We really need to invest in understanding the root causes of the disorder and explore every possible mechanism that might help. And those include some of those lifestyle changes, right? If we effectively treated all the people that had type 2 diabetes, we're going to lower the incidence of Alzheimer's. Maybe that's 5% of the people. But you know, to those people, that 5% counts. So to not invest is criminal.